Hello, everyone, and welcome back to the channel. I'm Dr. Your Name, and today we're discussing a topic that is incredibly important, especially for those of us over 45. We're going to talk about the heart, not just the obvious signs of a heart problem, like crushing chest pain, but the subtle, silent signals your body might be sending you. These are the whispers that can precede a shout, and learning to listen to them could be one of the most important things you do for your long-term health. As we age, our risk for heart disease naturally increases, but being proactive is our best defense. So, grab a seat and let's explore 5 silent signs that your heart might need a little extra attention. First on our list is something many people dismiss as just being out of shape: unusual shortness of breath. I'm not talking about feeling winded after running a marathon. I mean getting breathless from simple activities that used to be easy, like carrying groceries, walking up a single flight of stairs, or even just making your bed. You might find yourself pausing to catch your breath more often. This happens because your heart may not be pumping blood as efficiently as it should. When this occurs, blood can back up in the vessels that go from the lungs to the heart. Fluid can then leak into the lungs themselves, a condition known as pulmonary edema. This fluid in your lungs makes it harder to breathe. It's the same reason you can't breathe underwater. If you notice this happening, especially if it's a new development and it occurs with minimal exertion, it's a clear signal to get your heart checked. Don't just assume you need to hit the gym more. It could be your heart asking for help. The second silent sign is persistent fatigue. Now, we all feel tired. Life is busy and we often don't get enough sleep. But the fatigue I'm talking about is different. It's a profound, overwhelming tiredness that doesn't go away even with a full night's rest. It can feel like you have the flu, but without any other symptoms. You might feel too exhausted to do your normal daily activities. This kind of extreme fatigue can be a sign that your heart is struggling. A weakened heart can't pump enough blood to meet the body's needs. To compensate, the body starts diverting blood away from less vital organs, like your muscles and limbs, and sends it to the critical ones, like the brain and the heart itself. This leaves the rest of your body feeling drained and exhausted. If you're feeling bone-tired for days or weeks on end, and you can't pinpoint a good reason for it, your heart could be the culprit. It's working overtime just to do its basic job, and that's leaving you with no energy for anything else. Let's move on to our third sign: swelling in your legs, ankles, or feet. This is medically known as edema. You might notice your shoes feeling tighter than usual, or you might see indentations left on your skin after you take off your socks. You can even test for it by gently pressing a finger on your shin or the top of your foot. If the indent stays for a few seconds after you remove your finger, that's called pitting edema. So, what does this have to do with your heart? When your heart's pumping power is reduced, it can affect your kidney's ability to remove extra sodium and water from the body. This fluid has to go somewhere, and gravity pulls it down into the lower parts of your body, your feet, ankles, and legs. While occasional, mild swelling can be caused by many things, like sitting for a long time or eating too much salt, persistent swelling that doesn't go away is a red flag. It's a sign that fluid is building up in your system because your heart isn't circulating blood effectively. Our fourth silent sign is dizziness or lightheadedness. Feeling a bit dizzy now and then can be common, perhaps from standing up too quickly. However, if you frequently feel lightheaded, unsteady on your feet, or like the room is spinning, your heart could be involved. These sensations can occur when your heart isn't pumping enough oxygen-rich blood to your brain. This can be caused by a variety of heart-related issues, including arrhythmias, which are irregular heartbeats, or even blockages in your arteries that restrict blood flow. Your blood pressure might be dropping unexpectedly because your heart rate is too slow or too fast. When the brain is momentarily deprived of its steady supply of blood and oxygen, you feel dizzy or faint. If these episodes are happening more often, especially if they are accompanied by heart palpitations or shortness of breath, please don't ignore them. It's a crucial sign that the communication between your heart and brain is being disrupted. Finally, the fifth silent sign is discomfort in other areas of the body. We're all conditioned to think of heart problems as pain in the left side of the chest. But that's not always the case. The heart can send out pain signals that are felt elsewhere. This is called referred pain. You might feel an aching, pressure, or discomfort in your jaw, neck, back, or shoulders. It can even manifest as pain or a strange sensation in one or both arms, or in your stomach area. Sometimes feeling like indigestion or heartburn that just won't quit. For women, in particular, these atypical symptoms are often more common than classic chest pain. The reason this happens is because of the complex network of nerves in our body. The nerves from the heart run alongside nerves from these other areas, and the brain can get confused about the origin of the pain signal. If you have a persistent, unexplained ache in any of these places, especially if it gets worse with activity and better with rest, consider that it might be your heart trying to tell you something is wrong. So, to recap, our 5 silent signs are 1. Unusual shortness of breath with simple activities. 2. Profound and persistent fatigue. 3. Swelling in the legs, ankles, and feet. 4. Frequent dizziness or lightheadedness. And 5. Discomfort or pain in the jaw, neck, back, or arms. Recognizing these signs is the first step, but the most important step is taking action. If you're over 45 and you're experiencing any of these symptoms persistently, please schedule an appointment with your doctor. It might turn out to be nothing serious, and I hope it is. But it's always better to be safe. A simple checkup, maybe an EKG or some blood tests, can provide incredible peace of mind or, if needed, get you on the path to treatment early. Early detection and management are absolutely key when it comes to heart health. Lifestyle changes like a balanced diet, regular exercise, managing stress, and quitting smoking are powerful tools we all have at our disposal. Think of your health as your most valuable asset. Investing in it today will pay dividends for years to come. Thank you so much for taking the time to watch this important video. I hope you found it helpful. If you did, please give it a thumbs up and consider subscribing to the channel for more health insights. Stay safe, stay informed, and be kind to your heart. We'll see you in the next video.